Our next guest has over 30 years of experience in health and life science sector as an accomplished practitioner and thought leader in the development and application of predictive analytics. Today, Chief Health and Life Science Strategist at SAS Institute. Please welcome Mark Wolff.
Thank you very much.
You're so welcome. We've been talking a lot about the importance of data today, and you've described it as a 180-degree turn. Today we are our own suppliers. Could you elaborate a bit on that?
Absolutely. I think we're all aware of the potential of collecting data about ourselves, especially from wearables, from our phones, from our watches. What's important about that is think about this paradox. We are only measured when we're sick. Nobody collects your temperature, your blood pressure when you're not sick. You go to the doctor, they collect those data, and they only represent a tiny fraction of the data that describes who you are. Today, we not only have sensors and technology that we wear, but also we find ourselves in environments that are sensed, whether it's through computer vision, whether it's through cameras, whether it's through environmental sensors of environments that we're in. It is a potential huge opportunity to measure us when we're not sick. And that may be the most important form of data, because then that can be put against the data when we're not well, and quickly add value to the diagnosis and to the treatment plan.
So you suggest that this data that we collect ourselves should be shared with our doctors?
That is an interesting question. I ask myself that question, should I share those data? Forgive me, this is a long list, but let me read a list. So if you have an iPhone or almost any smartphone, whether you know it or not, and I'm in this business and I didn't know all of this, and I just recently found this out. Here are the data that are being collected right now. Sleep, steps, walking distance, double support time. Do you know what that is? Step length, walking speed, walking asymmetry, flights climbed, walking steadiness, stairs speed up, stairs speed down, walking heart rate average, and something called the 6-minute walk, which is actually a classic diagnostic test. If you give me your phone, and I take those simple data that are being collected right now, whether you know it or not, passively, I can build a model that will be better than the face recognition model on the phone. I will be able to tell you exactly who you are, and I'll be able to use those data to compare when you're not feeling well. And I can probably diagnose much faster the problem because I have all these parameters. And in fact, gait, walking, balance is almost as indicative as your face. And in fact, speaking of democracy, there's a certain government that when people started wearing masks, started using computer vision to analyze gait to identify who you were.
But back to the question, would you share it or not? But people
No,
you wouldn't share it.
No.
But seriously, people could feel a certain hesitation of giving away this data. What would you say? Is it a legitimate worry?
So I shared with you those details that will describe who you are in intimate detail. I should know better, but I don't want my physician to know that information. I would share the data at a population level. I would absolutely share those data at a population level. My demographics, my data compared with everybody else is of immense public health value. But my personal data, that is, I just don't want my doctor to know when I'm drunk.
Okay, maybe that's a problem for you personally, but if it, sorry, not to be indiscreet.
No, I'm not that I'm drunk that often.
Okay, but if it could help and predict illness and help the healthcare, would you suggest that we should give it away if we feel secure that our physician is going to treat it with integrity?
Absolutely, I would. I think those data form a tremendous baseline analysis potential for when we're healthy. Like I said, we don't have those data and we desperately need those data. And when you have a comparison that is of tremendous diagnostic value. You're not well compared to what? So I was kind of joking, I wouldn't share it with my doctor, but that would only be for maybe reasons of vanity. But from a health perspective, for my doctor to know those data the next time I visit, absolutely.
Because you say that we give away much more sensitive data already, right?
We do. We give away a tremendous amount of data. Like I said, those parameters on the phone, I didn't know half of those were being collected. And they're really important things about how we behave. Cameras that are looking at us in places that we are for security, they're equally capable of extracting healthcare data from how we behave, how we walk. I know that in some cases in the United States, insurance companies that monitor car insurance will put a tracker on your car and give you a discount on your car insurance. Now they know whether I speed, how far I drive. Now they have a state into my mental health. Am I an aggressive driver? So even into the realm of mental health, those data that are passively being collected by us simply existing in environments and carrying our technology are tremendously powerful. How do you use those data? I think you can use them with great effect for public health and personal health.
Could it actually change the way we organize public health, do you think?
I absolutely believe so. The idea that, for example, I was working with some architects on smart environments for healthcare facilities. How could we, for example, put technology into a waiting room in an emergency department to monitor people in that room and identify the ones that need help first, and actually do triage on an emergency room using computer vision so that the patients will get attention that need it without necessarily asking for a doctor or nurse to keep coming in and checking on them. Now we've created efficiency. Now we created better patient flow. More people get to see more doctors, better access. Technology can introduce efficiencies. Technology can lower the barrier to diagnosis through those data. But we still always have the questions of privacy. We have the questions of sharing. And we've been discussing those all day. I don't have the answer to that. But as an analyst, as a scientist, and someone who collects data, I believe those data are of value both privately and publicly.
And I know you've also been talking about shopping data as a sort of indicator of how we're doing.
This is yet another aspect of what I would call almost passive data collection. I think globally people use loyalty cards, cards that give you a discount, cards that give you some benefit or some convenience at a store. There's a program in the UK, in the National Health Service, where a partnership between an analytics company, just happens to be the one I work for, the NHS, and grocery stores, coming together, using your shopping behavior, using what you buy, where you buy it, how often you buy it, as a means of reconciling at a population level the incidence of cancer. So can we understand behavior both nutritionally, behavior both from maybe buying things you shouldn't be buying so often, whatever those things may be? Can we also use activity data? Imagine what you buy, how much you move, where you live, bring that together, look at that at a population level against the incidence of certain types of cancers, and you start to understand what may be hotspots in a community that may need attention. You've now created efficiency in identifying where to put resources for greatest benefit. So I don't know how you feel about sharing your shopping data. It is also, I think, very, very intimate and illustrative of who you are and your habits and your behavior. But again, you start bringing those data together and we start forming an incredible baseline that we can reconcile against public health information.
But we share it with the grocery store. They keep on sending me offers that do I buy this orange juice all the time? It's terrible. But we do that.
Isn't that a paradox? Isn't that a paradox? We'll do it for a discount on potato chips, but we won't do it maybe for improved health.
But when you work with these issues all over the world almost, what are the strongest arguments against using this data that either we collect ourselves or we collect it ourselves, but in different ways? What are the...
Security and access to those data is always an issue. It's a global issue, and it varies from country to country depending on sensitivities of that country in terms of how potential data may be misused. It also varies by misunderstanding, perhaps on the part of the person collecting the data, about actually how representative those data are, how intimate those data are. But I think in the end, it's also a question we have to ask ourselves. What is our role as a citizen vis-a-vis the public good? And the public good being improving healthcare for all. Do I want to contribute to that public good? And what is the value of my contribution? And it can be significant. So it can be even an ethical question. Do I feel compelled and obligated as an engaged citizen in a democracy to continue contributing to that society through donating my data, the data that's collected on me every day across my everyday life.
And you, as living in the US, do you feel secure or comfortable with sharing your data in the US? Being this good citizen?
I think the greatest danger in the US is, I think this is a fair statement, it's less a fear of the government, but a fear of the marketers. I think you will be suffocated by offers, and you will be targeted. You will be profiled to the point that when I walk by a shop, I'm going to get a text message saying that the potato chips are on sale. Hurry up and go get them, and we'll give you an extra 10-cent discount. That is that's scary, isn't it? But that's more on the consumer side, not on the political side. So in the US, I think the perception is more, we value our privacy more to avoid the marketing and the consumer attacks, less the political and the government.
And if you, just to one last question, if you look like 10, 15 years ahead from now, how do you think we're going to use this data?
So one of the I think more interesting technological innovations that have been pushed forward since COVID is this concept of remote patient monitoring. Germany and other European countries has just recently created reimbursement schemes. So you get sent home from the hospital with a scale or a blood pressure cuff. You can be sent home and you can have your phone connected to a cloud source where you monitor certain data. This is now becoming normal, monitoring our health at home for our doctors. Now, if that is part of the norm 15, 20 years from now, I think, let's say from an insurance perspective, just like the person gets a discount on the car insurance, I'm going to get a discount because I exercise. I'm going to get a discount because I eat nutritious food. I'm going to get a discount because I'm keeping my sugar low, my blood pressure, so on. The other side of that story is that is possibly not a fair or equitable trade. Maybe I am in the position to get that discount and change my life and my behavior. Many people may not be in a position to do that. So now we have the question, how do we deal with equity, where data becomes a currency, and a currency you can use for your benefit? That's a difficult question. And thank you for indulging in English. I appreciate it.
Thank you.